Hey everyone, my name is Sarah and welcome back to Everyday Consent. Before today's video, I'd like to make a quick disclaimer. Believe it or not, I am not a doctor. For today's topic especially, I highly encourage you to do some of your own research and consult health professionals of your choosing to learn more. A while back, I made a video about self-awareness, which you can see here. In that video, I talked about why being aware of ourselves, our minds, and our bodies is a big first step in communicating with our partners and understanding each other's boundaries and desires. Today I want to continue talking about self-awareness, specifically when it comes to pain during sex. In particular, I'm talking about the kinds of pain that we ignore or put up with because we think we have to, or because we think it's normal. Quick note, talking about what's normal when it comes to sex is a very tricky thing. We use the word normal to mean a lot of things. Sometimes we mean, is this something that everyone experiences? Or we might mean, is this something that anyone at all experiences? Sometimes we mean, does this make me a freak? Does it mean something's wrong with me? Or that I'm a bad person? Sometimes we mean, does this make me special? Or more interesting? All of these are important questions. I just want us to be really careful about knowing which ones we're discussing. So, for the purpose of this video only, when I say that something is not normal, I mean that it is not inherently necessary, and that if it is harmful, it is needlessly so. So, with that in mind, I want you all to know, unintentional, undesired pain during sex is not normal. Sex does not have to hurt. The pain is almost always avoidable, or at least improvable. Sadly, this is not always the case if there is some chronic condition or other issue involved. Sometimes that pain can be improved or mitigated too, but that's not the kind of pain I'm talking about today. Also, pain can be a very positive part of sexual experiences for many people, when it is intentional and mutually agreed upon, but that's also not what I'm talking about today. I'm just talking about unintentional, usually accidental pain, and that pain does not have to happen. To some of you this might be obvious, but from my own experiences and those of my friends, and from all kinds of discussion boards online, this apparently needs to be clarified. I've heard and read all kinds of questions and stories about people experiencing some sort of pain during sex, but being so unsure whether it's normal or not that they don't tell their partner what's going on and just let it keep happening. Which is kind of weird and upsetting, right? So why does this happen? One thing I've noticed is that these experiences seem to be especially common in people who are newer to sex or to particular sexual acts. And I think it's common for them not to talk about their pain because it is new. Sex is very complicated and involves all kinds of new sensations and experiences. And if it's all new to you, then you don't really know what to expect. So you might even think that pain is normal and just part of the experience. I know that was exactly what I thought when I started having sex. I had a lot of issues with my cervix getting hit during penetration, which caused this odd, intangible discomfort that was also often painful. I would describe it as kind of when you put your finger in your throat and get too close to your uvula. Like that feeling, but worse. I also sometimes would get weird shooting nerve pains whenever my partner would touch my clitoris too quickly or too roughly. So I was having all these painful experiences, which I'm sure my partners were not trying to cause, but I wasn't telling them about it, or in many cases even trying to make them stop. Why? Well, for one thing, the sensations and where I felt them were really new and unfamiliar, so initially I didn't even necessarily register them as pain. And I knew that I wanted sex, so I figured I must want this too, and I'd probably learn to enjoy it. It was only over time, and from talking to friends and reading books, that I realized not only could I have sex without these problems, but it was much more enjoyable without them. For the cervix pain, I learned that changing positions could help, and for the clitoris issue, I learned that just waiting longer until I was more physically aroused or using lube could do the trick. I also learned that I could tell my partners about this, and that they'd be happy to make changes so that I could be more comfortable. But let's back up a second. I said earlier that I wasn't always sure what I thought about these sensations because they were new. Basically, I didn't understand what I was experiencing, and I had no idea how I felt about it. But how is that possible? How could I not even know whether I was hurt? This might be more common than you think. When very small children hurt themselves in a mild way, they don't always immediately react. Instead, they'll look to the adults around them to see how they respond. If the adults freak out and run to them and say, "Oh, you poor baby!" then the child will start crying. But if the adults respond calmly and say, "Are you okay?" in a positive, calm manner, then often the child won't cry at all and will just go on their merry way. This is because one of the things the child is doing when they look around after they get hurt is taking subconscious cues from those around them to help them define the experience and the appropriate reaction to the experience. And while sometimes pain is just pain if it's severe enough, a lot of how we process it and frame it is learned, largely from these childhood experiences. I think this process of learning to contextualize pain comes up a lot when exercising as well. Not all pain is inherently bad, and in fact, at its core, working out is really inducing pain and discomfort for positive reasons. No pain, no gain, right? But not all pain is made equal, which is why it's important to get help from a friend or an instructor to distinguish good pain from bad pain. Anyone familiar with exercise will know that pain from working your muscles is constructive, whereas pain from pulling a muscle or injuring a joint is destructive and should be avoided. But someone who is new might not be able to figure that out without help, which is why it's really unsafe to use a new machine or try a new move without any training. They easily might hurt themselves, and not in a beneficial way. But this also goes both ways. An instructor needs to teach the student how to move and how to interpret what they feel, but the student also needs to tell the teacher what they're feeling in the first place. With any luck, this means that over time, the student gets better at observing what their body is feeling, communicating that, and with the instructor's help, interpreting that and moving forward. And this, my friends, is called body awareness. And so, pulling this all together, this applies to sex as well. The first step is listening to our bodies, paying attention to what we're feeling and trying to put that into words. Even if it's unfamiliar and hard to describe, we can at least try, and with practice it might get easier. The next step is learning how to interpret those sensations. This might just mean thinking to yourself, do I like this? Am I concerned about this? In many cases, we'll need some help interpreting, because, like our student working out new muscles, an instructor can help keep us from damaging ourselves. This might mean talking to friends or looking things up on the internet. I'll take this opportunity to recommend talking to a health professional. Don't worry about sounding dumb. If you are concerned, please talk to a health professional. Better safe than sorry. And lastly, once we know what we're experiencing and what that means to us, our next step is to share that hard-earned knowledge with our partners. We call them partners for a reason, and that's because they're there to help and learn with us, towards the common goal of having a great freaking time. Happy consenting, folks. I'll see you next week. Hey there! Ugh. Okay.
We're back!
People... Come on. Okay.
Is there a mosquito?
In my brain. My glitters. My glitters. My glitters. Okay. I mean, when nothing else makes sense, it's probably poop.